Hope Channel, changing lives.
Good evening, and you are welcome to the consulting room. Just like we come on your screens every Monday at 8 p.m. Today we are here in the studios of Hope Channel, and we are in the consulting room. I'm very happy today. At least I thought that I didn't want to support Ghana, but it looks like whenever they are playing their matches and they score a goal, then the spirit is rekindled. So congratulations to the Black Stars for their win, and hopefully they get to give us more things to jubilate over in these times, these very hard times. And growing up to there was this man in my community where I grew up. I've forgotten his name, but then he used to have these very tiny, and sometimes some of them grew bigger, some spots on his face. And when I asked those times, they told me that it was Kooko. Then another time, somebody had issues with their tummy, and they went to the washroom and they said they had poo-pooed blood. I'm trying to be not to be gross so that everybody can enjoy the show. And I asked, what is wrong with that person? Because I've always been a curious person, right, from childhood. And they said it was Kooko, so I was wondering. Kooko, then I grew up and I heard the name Pals. Then I came to medical school and they said Haemorrhoids. So today we have ASP Dr. Benedict Osei Kwame Ajiman. You know, I didn't know your full name. I just knew it to be Benedict, but then ASPO is my senior in medical school. You're welcome to the consulting room.
Thank you very much.
I like the way you've been able to wear your dress. I didn't wear it, yeah. But we are all supporting.
We brought back the love.
Yes. I hope your day has been good.
Splendid.
We thank God. Hey, hardly do I hear doctors say that. Why? What happened?
I mean, Ghana winning coupled with everything. It's a good day.
Well,
yeah.
Yes. So you're welcome to the consulting room, Dr. Benedict. And to all my viewers too, you're welcome to the consulting room. Today we are talking about hemorrhoids, Kooko, pals, all the names that you might have heard in your various local languages. Yes, that is what we are talking about. And sponsoring the show as usual is Kooko Milk. If you want to prevent yourself from getting constipated, which I think leads to a lot of people having this pals, you should take a lot of Kooko Milk because it's non-dairy, it's plant-based, it has no sugar, no additives, it's natural. It's good for everybody, from babies that have been weaned right to adults that can only drink fluids, can only take fluids. So it's good for everybody. And before we forget, I hope we all remember that we'll be having Pella Fest, an a cappella music festival on the 31st of December at the National Theatre. So do well to get your tickets. They are going for 150 cedis for one, for the VIP, 70 cedis for a single ticket, and 300 cedis for a family of 5. Yes, so do well to get your tickets and join all of us. Give thanks to God at the National Theatre on the 31st. We'll go for our very first break. When we come back, Dr. Benedict will tell us all about Kooko and all the falsehoods that we know to be raised. Do well to join us when we come back.
Dairy-free coconut milk. Kooko dairy-free coconut milk. It's a fully plant-based milk, non-curdling in tea or coffee, and it's a lovely treat with any breakfast beverage or meal. It contains calcium and vitamin D2 for strong teeth and bones, and vitamin B12 to help boost your blood for vitality. Kooko is 100% vegetarian and is approved by the Vegetarian Society of UK. It's also lactose and dairy-free, which is good even for people with lactose intolerance. Kooko, get one today. Kooko dairy-free coconut milk. Nature's health at your doorstep. For bulk bulk purchases, contact 027-444-0180. This advertisement has been vetted and approved by the FDA. Kooko dairy-free coconut milk.
Yeah, welcome back to the consulting room. So, right to the point of this show, please, what are hemorrhoids? Is it what I was saying, the things on the face, or the growth in people's eye, or what exactly are hemorrhoids?
Okay, thank you very much, Mami. Warm greetings to the viewers too.
Yes.
So we break it down. Hemorrhoids. So hem meaning blood, and rose, actually rose meaning flowing.
Okay.
So you combine hemorrhoids, actually blood flowing.
Okay.
Blood flowing. So basically, if I break down the word hemorrhoids, it's blood flowing.
So the thing on people's faces, is it hemorrhoids?
So along the line, we will debunk some myth that has been generated over a lot of years. Along the line, we'll get to understand what hemorrhoids actually is, and then certain misconceptions about it.
Okay.
You asked the question about what they are.
Yeah.
Now, hemorrhoids are normal vascular cushions. When I say vascular cushions, they are like blood vessels, collection of blood vessels, venules, arterioles, and then some suspensory ligaments, or more like muscles that support at the inner region. Okay. At the inner region. Now, we will say that almost every human being has hemorrhoids, but it's been confused with the pathology. The pathology comes in when it's engorged. When these vascular cushions get engorged,
so then the blood vessels.
The blood vessels get engorged. Then you see hemorrhoidal disease.
Okay.
For the purpose of this discussion, every hemorrhoid we say refers to the pathology and not the normal anatomy. Okay.
So everybody has those blood vessels around their anus.
Yes.
But then it is when it gets it becomes big.
Yes.
It gets enlarged and the blood stays there. That's when we say that
it's a hemorrhoidal disease.
Okay.
But then you can actually also use hemorrhoids.
For
the purpose of this discussion, any hemorrhoids we say is the pathology and not the normal anatomic structure. Okay. Yeah.
So since you didn't make any reference to the face, because that is what a lot of us grew up knowing, especially those of us who lived in the semi-urban, semi-rural communities. We had these, I've forgotten the name of. They go to the community centers and they PA systems, yes, public address systems, and they go and they are selling all these concoctions and they Kooko no they found here so that is not a hemorrhoid.
No. So once we know the anatomy of these blood vessels, we realize that it has no correlation with any growth on your face, on your eyes. When you say hemorrhoids, it's just at the inner region.
At the inner region.
The inner region. But in Ghana, anything we don't know, we tend to ascribe it to hemorrhoids.
Kooko. Yes.
So Kooko is everything.
Yes.
It's everything.
Because you ask them what exactly it is and they will tell you, oh, that is what is causing you to have diarrhea. That is what is causing your head to hurt. No. The amamai in Kooko, we have all these things that we say. Okay, so dear viewers, please, hemorrhoids is just in the inner region. For those who might not, yes, that place, that's where the hemorrhoids occur. Please don't let anybody lie to you and make you buy any concoction to go and apply on your face, especially if the person is not a certified medical doctor. Okay, so what causes these hemorrhoids, Dr. Benem?
Okay, so the main thing is that then what's if we say that they are anatomical structures, they are normal in every human being. What's their use? What's their function?
Yeah.
Okay. So the basic function is to help with continence of fecal matter. Okay. Continence is basically helps with the flow of fecal material. So these hemorrhoidal structures or these blood vessels help with this continent. Now we come to the cause. Actually, is not known, but we talk about risk factors.
Yeah.
Things that you do that puts you at risk of developing hemorrhoids. That's what we talk about.
Yeah.
So the basic thing we should understand is that anything that increases intra-abdominal pressure, anything that increases the pressure in your abdomen,
okay,
causes these blood vessels
a lot
to
of
get
us
engorged.
Don't know abdomen is different from stomach.
Yeah, so I'll try to break it down. So anything that increases the pressure in your tummy actually gives you a risk of this blood vessels becoming distended or becoming bigger or becoming engorged. Okay. So we talk about risk factors. So when you talk about things that increase the pressure in your tummy, then you talk about straining. Straining like you go to the loo, you really force, push to bring something out.
They will really strain, and when you are standing outside, you even feel feel sorry for them.
Yeah. So if you strain like that, you actually cause an engorgement of these blood vessels, and then they distend. They distend. So if you strain one, if you are constipated, two, if you go to the loo and you sit on the water closet for so long,
those people that go with their phones.
So now people have developed the habit of going to the loo, now reading newspapers or pressing their phones. They spend more than 15 minutes there. It increases your risk of developing hemorrhoids. Okay. Because one, it causes a tourniquet effect. Tourniquet effect is like, okay, if I tie my hand, here, I know that no blood is going to flow here. Yes. So if you sit on it, then there's a pressure on the blood vessels at your inner region. Then it reduces venous return.
So
normally
the blood that has come is not able to go back. Okay.
It causes stasis and it engorges and enlarges these blood vessels. So that is also one. For people who lift weights that are heavier than them.
The macho men.
So even for them, we have these belts that they put, put on to actually help with this intra-abdominal pressure in your tummy. So that one too. Then the next set of people is pregnant women. Okay. For pregnant women, is to deal with one, the size of the baby in the pelvis, compressing blood vessels in the pelvis, such that blood cannot return back to the heart. So there's decreased venous return. It causes distension of these blood vessels. Another thing is that pregnant women have a lot of hormones. So the hormonal changes has also been implicated. And then the third one with pregnant women is they tend to get constipated a lot. So then once you strain, then these blood vessels distend.
Already the baby is not letting the blood go up more. Then you are constipated. Then you have to force. When you're forcing, the vessels are getting bigger. Then your hormones, in addition to the baby too, is not allowing everything to go. Oh, okay. Pregnancy.
So it's multifactorial in pregnancy. Multifactorial in pregnancy.
Wow. Okay. So we spoken about the increasing pressure in our stomach.
Tummy.
Can you give us some more like examples with that one, because you explained the other ones and it's not with that one.
Okay, so when there is increased pressure in your stomach, it reduces, it prevents.
No, not how it causes it. Like, what are some of the things that will cause the increase in the stomach, as you are saying? Yeah.
Okay, so some of the things that can cause increase in the intra-abdominal pressure or the pressure in your stomach. One of them is chronic coughing. If you cough a lot, the pressure, every time you cough, not once, but if you cough multiple times, you realize that you actually feel like
some
pain in your tummy. The pressure actually increases. So if you cough a lot, if you have other comorbidities or diseases, like maybe a huge fibroid, it also can actually compress blood vessels in your tummy. So those are some of the things that increases pressure in your stomach.
Okay, that's how common are hemorrhoids? How common are they? Because and by this I mean the hemorrhoids in the true meaning of hemorrhoids. You know, a lot of us have this misconception, as we are trying to dispel that misconception. But how common are hemorrhoids? The true hemorrhoids, how common are they?
So I would say that they are very, very common. But one thing we've got to notice is that a lot of people feel embarrassed when they have these things. So the true prevalence of it is actually not known because people don't report. There's underreporting of this hemorrhoids because of the embarrassing nature, or in quotes, embarrassing nature of it.
So talking about it being embarrassing, I don't know if you've ever heard these radio adverts talking about Kooko. Oh yeah, Bearmana, Okobiana. It's as if you are having your menses. You know how we demonize menstruation? Yes. So if you're a man and you are having bloody stools from your hemorrhoids, then it's a bad thing, and they make it sound like it's so bad nobody is supposed to know about it. So I guess that's also like a big factor.
That's also actually contributed to the fact that people underreport it.
Yeah.
So people get it and then resort to a lot of methods to actually treat it.
Okay. Yeah. So what are some of the things that I should look out for if I don't already have it? What are some of the things that can happen in me to make me know that maybe I might be having a hemorrhoid?
Okay, so Mami, thank you. So then you talk about the symptoms of hemorrhoids.
Some of the symptoms.
So the commonest one is painless bright red blood.
Okay. On
your tissue paper. When you go to the loo, you wipe your anus and then you see blood. Normally, this blood is not mixed with the stool. It's not mixed with the feces. So if you see blood mixed with the feces, you must be thinking about another thing.
Something else. Okay.
So, and I talked about it being painless.
Painless,
it's not painful also. So if it's painful, you must think about another thing. And it's being bright red. So if you see the blood, the color of the blood, and it's dark red,
then there's something
you must think about
else.
another thing, another differential.
Okay.
Yeah.
So
that's the commonest one. Then follows itching at the inner region. So when we talk about the types of hemorrhoids, you get to know why there is itching at the inner region. So most people experience itching at their inner region. And then some people also experience their buttocks being wet. Their buttocks being wet. Some people also experience that. And then people also feel a feeling of a mass at their inner region. A feeling of a mass at their inner region. And then in some occasions, depending on the type of the hemorrhoids, there is pain. There is pain at the inner region. Okay. Yeah.
So you've been making some comments about depending on the type. Are there types?
Yeah.
And if they are, what are they? Okay. Maybe the differences so that we understand what we are talking about.
So there are types of hemorrhoids. So I talked about the anatomy of the hemorrhoidal cushions, that these blood vessels. So then you look at the inner region, there's a point, a mark, where you use that. This is the line we draw at the inner region. We call it the dentate line. If you're able to pull up an anatomical structure, it can be very helpful. So the dentate line. At this dentate line, anything that happens above this dentate line or pectinate line, now I can't break it down.
Yeah,
it's an anatomical structure.
I'm trying
anything
to
that happens above it is internal. Anything that happens below it is external. Okay. Now, when it comes to the symptoms, you get to realize that most of the things that happen above it are painless. I talked about painless bright red bleeding per rectum. And then I also talked about sometimes it can be painful. So anything that happens below it becomes the external. So we have internal hemorrhoids and then external hemorrhoids. Internal hemorrhoids happen above the dentate line. Then external hemorrhoids happen below the dentate lines. Okay.
So what's for some of the symptoms, for instance, the bleeding, you said it could be painless. Which one gives the pain and which one doesn't give the pain? Okay, or they are all the same?
So you look at the pain and its relation to embryology, how we're born. Now you get to realize that above the dentate line, it's actually endoderm. It means that that area is not supplied by any nerves, somatic nerve fibers. That's why above the dentate line there is no pain, so it's painless.
So there aren't nerves there, so you cannot
pain nerves above there. But below it, you get to realize that there are pain nerve fibers down there. So then, when you have external hemorrhoids, you can actually experience pain. Pain. In some conditions, the internal hemorrhoids, the ones that happen above it, become painful when they prolapse and become thrombos. Along the line, when we go on, you get to realize the grading of the hemorrhoids, and then we appreciate why there is even pain, even sometimes in the internal hemorrhoids.
Okay, so we've spoken a bit about the anatomy. I was trying to get the image, but then I think when it's ready, we'll go over it again.
Sure.
Yes, and we've spoken about some of the symptoms or the things that show when somebody might be having a hemorrhoid. What should I do if I go to the toilet and I wipe and I see blood in the tissue? What do I have to do?
Okay, so that's a nice question, Mommy. So when you go to the toilet, you wipe, you see bright red blood on your tissue. The first thing you have to do is to actually, if you can, it's not if you can, you must go to the hospital. The doctor would assess you to, we call some things differential diagnosis. It may be hemorrhoids, it may not be hemorrhoids, depending on your age and depending on the color of the blood that you are seeing and other symptoms or things you're experiencing. You may be diagnosed. So get to the hospital. The doctor will examine you. He will do a physical examination of you. You also look at your anal region. Okay. We'll do what we call a DRE, digital rectal examination, where the doctor will wear a glove, lubricate his hand, and pass it through your back passage.
So they'll put their hand in your anus.
Lubricated hand at your back passage.
Why lubricated?
There's some apprehension when someone is poking the hand through your back passage. So you will be reassured that it's not painful. And then it's to actually look at the anal region, inspect first, and then palpate to see if there are these enlarged, because we said they are enlarged. So if there are these enlarged cushions, and then they have a camera that they even use to look through your back passage to see these cushions that are enlarged.
Do we have some of that in Ghana?
Oh yeah, why not?
Where in Ghana?
It's called the anoscope. Most hospitals have these things.
Doc, you are sure most hospitals have it? Okay, so after the doctor is, you've seen the doctor, they've spoken to you, they've examined you. What do they do for you? What can be done about it? Okay,
so before we get to what can be done about it, I would send us back to the grading of the hemorrhoids. So I talked about internal hemorrhoids happening above the dentate line, and then external hemorrhoids happening below the dentate line. Then we grade hemorrhoids too. So the grading of the hemorrhoids is with the internal hemorrhoids. Okay. So most people, the ones that people can see is the external hemorrhoids. So when someone says that you have Kooko, it means that the person actually sees it.
Yeah. Some people even tell you they can push it back.
Yeah, that's the external hemorrhoids. They see it. But when it comes to the grading is with the internal hemorrhoids, not the external hemorrhoids. So if you say the internal is inside, so it's graded on four degrees: first degree, second degree, third degree, and fourth degree. Okay. So for the first degree, there is just bleeding, but there is no prolapse. Nothing comes out. You can't see it. Okay. Then there is a second degree. The second degree, there is prolapse, but it reduces spontaneously. It means that it comes down but goes back in on its own.
You don't have to do anything to make it go.
Push it inside or anything at all. Okay. Then there is a third degree. The third degree, there is a prolapse, but then you have to manually reduce it. You have to actually push it inside. That's the third degree. Then there is a fourth degree where there is a prolapse, but you can't push it in. It's irreducible. Okay. It's stuck. It's just there. Yeah. So 4 degrees of grading internal hemorrhoids. Yeah.
So that one, it's the doctor that will be able to tell you whether it's internal or external. And they do that by doing all the examinations.
And obviously, if you use the mirror and you see something there, you can say maybe it's an external hemorrhoid, but it can also be internal hemorrhoids. So then I drag it back to the gradient and what it will be done for you in the hospital. Yes. So then you tackle it on 1, conservative measures that can be taken. Okay. 2, non-surgical methods, and 3, surgical methods
okay.
with the treatment. So conservative method. So we must understand that most of the things done for hemorrhoids is actually to reduce this engorgement or enlargement of this blood vessels or these cushions. So the first thing that can be done for you at home is, at home your doctor can advise you to do sit baths. Lukewarm water, you sit on it. It actually warms and then helps with the inflammatory process going on. So this will also reduce the swelling that is happening there. So sit baths. 2 is topical analgesics.
Okay.
Analgesics are like painkillers. So then on the market, we realize that there are a lot of creams on the shelves that it can give you that you insert. So the main reason is to actually reduce this inflammatory process, reduce this swelling. The third one is stool softness. Stool softness. We talked about if you are constipated, it being a risk factor for these hemorrhoids. So when you get stool softness, it brings out or it alleviates the portion where you be constipated. So it helps with free flow of bowel, and then so that also helps. And then we will be advised on proper anal hygiene. What's proper anal hygiene? 1, making sure you are not reading in the loo. There are some activities that you shouldn't do. You shouldn't be sitting on the loo for more than 30 minutes because we've talked about a tourniquet effect where you sit down. They prevent the blood from going out, reduce venous return, causes the distension of these blood vessels. So 1, don't do that. 2, anything that causes increase in the pressure in your tummy too, you must try as much as possible for it to be abolished or for it to be reduced. So for the things that modifiable risk factors that you can avoid, lifting things that are so heavier than you and everything. So talk about proper anal hygiene. So I've touched on 4 things. 1, sit baths. 2, stool softness. 3, topical analgesics. And then 4, proper anal hygiene.
So those are the
conservative ways you can deal with it. And this also depends on the grade. So for example, grade 1, you can use conservative. There is no prolapse, you can do it. Or maybe there is prolapse but it reduces manually. You can do reduces automatically, you can do it. But when it gets to grade 3 and 4, you can't use this conservative method for it. Or if you are experiencing pain, you can't use this conservative methods. Then you come down to non-surgical methods. And then surgical methods for grade 3 and 4. So 2, 3, 4, you touch on non-surgical, surgical methods.
So we've spoken about the conservative. So what are the non-surgical first before we go to the surgical?
So the non-surgical, there are a lot of things that you can do. One of them is, we call something sclerotherapy. So sclerotherapy is just injecting a dye into the enlarged blood vessels to actually shrink it. So the purpose is to reduce the blood in it, the blood flow in it. Thereby shrinking it. Sclerotherapy. The second one is rubber band ligation. You can actually use a rubber band to tie the blood vessel around it. So if this is the vessel, we tie here. Then over time, there's reduced blood flow here. So it dies off. So we have sclerotherapy. We have rubber band ligation. There is even cryotherapy where they use ice. So you freeze the upper part.
The ice here is a specialized kind of ice.
It's not
Please
the ice.
don't go and take ice block at home. No, that's not what we are talking about. It's the doctors and the surgeons who know what they will do for you if they want to use the ice. But it's not the ice block in the fridge. Right.
Thank you for the clarification, Mommy. And so there is also cryotherapy where it's not the ice in the fridge, please. We've clarified it. Where they use ice to actually.
First, someone will go and say, "Oh, there was this ASP. He came on TV and he said we can use ice."
It's not that. So these are methods that I use, and so when it gets to grade 4, then. And sometimes it's an emergency. For the external hemorrhoids, it's so much pain, unbearable pain. So that one, it happens because there is a clot of blood that's formed in these enlarged vessels. So if a clot of blood is formed, we call it thrombosed. So then it means that once we relieve you, give you pain medication, we must actually prepare you for surgery. It's called a hemorrhoidectomy.
Yeah.
Hemorrhoidectomy is actually cutting
parts
away,
of the vessel,
make it smaller. So hemorrhoidectomy. So even for hemorrhoidectomy, there are a lot of types of hemorrhoidectomies that the surgeon will perform for you.
Okay, so we've spoken about the conservative, non-surgical, and I'm sure we'll go for a break and we'll come back. Then we'll talk about it again because I'm sure people will be asking questions as the time goes. So we'll go for our very next break. When we come back, we'll still be talking about hemorrhoids and what to do, at the very practical ways to go about it. So do well to join us when we come back from this break.
Kooko dairy-free coconut milk. Kooko dairy-free coconut milk is a fully plant-based milk, non-curdling in tea or coffee, and it's a lovely treat with any breakfast beverage or meal. It contains calcium and vitamin D2 for strong teeth and bones, and vitamin B12 to help boost your blood for vitality. Kooko is 100% vegetarian and is approved by the Vegetarian Society of UK. It's also lactose and dairy-free, which is good even for people with lactose intolerance. Kooko, get one today. Kooko dairy-free coconut milk, nature's health at your doorstep. For bulk purchases, contact 027-444-0180. This advertisement has been vetted and approved by the FDA. Kooko dairy-free coconut milk.
For one night only, the city will converge at the National Theatre as United in Praise presents the A Cappella Festival. Yes! Brace for a divine musical experience on Saturday, December 31, as Ghana's hottest a cappella groups usher us into 2023 in a grand style. On stage performing Black Capella, The Manifest, Vocal Path, Note 6, K3M, New Era, Soul Street, and many more. Special appearances by Pesdak Praise Choir, Gifted Dear, Mark Enimirenchi, and Perez Music. Get an early bird tickets now at a cool 70 Ghana cedis standard for single, 150 Ghana cedis VIP, and 300 Ghana cedis for a family of 5. Simply dial *928*529# to get your tickets now. The A Cappella Festival is proudly endorsed by Beyond the Return and supported by Charterhouse, Events Dome, Midima Fuheba Clinic, Meridian Ghana Conference, and powered by United in Praise. Pella Fest, a Hope Channel Ghana production.
Yeah, welcome to the consulting room. Today we are having a conversation with ASP Benedict, who I didn't know his full name, but today I know. Benedict Osei Kwame Ajiman. Yes, doctor. So which one, how do they call you? Dr. what? Dr. Benedict or Dr. Anyway, that's by the way. So we are talking about hemorrhoids. We've spoken about the things that can increase your risk of getting hemorrhoids. And now Kooko, the one at your anus, not the one on your face. That is not Kooko. So you sitting on the WC for a long time, pressing your phone, reading the graph. Yeah, so this one is not just the our generation people that are doing it. The elderly people will go with their lotto papers. Anyway, that's bad. They'll go with their graphic and their newspaper. Why did I say graphic? Anyway, they'll go with their newspapers and they'll go and sit on the WC or whatever form of toilets they have to use. Yes, it's very bad. And the doctor has explained what that has to do with it. So you were talking about the ways of treating it. And we've spoken about the conservative and the non-surgical and the surgical. Does diet or food have any correlation to hemorrhoids?
Okay, Mami, thank you for the question. So we talked about what causes it.
Yeah.
What increases the risk factors. So then you get to understand that a good lifestyle, a good diet actually goes a long way to reduce your risk factors.
Yeah.
So you talk about things that will actually not make you constipated. So eating foods that will let you form a lot of heavy or bulk stools. Example of them is eating cereals like maize, like wheat, digestive biscuits, fruits, apple, mango.
That's for fruits there. We know a lot.
Orange. Even our normal fruits, we can have even contemporary helping you. So these fruits and then these types of foods actually help you not to be constipated. So then it reduces.
So my production team is asking if Sobolo is part.
I beg you. So Sobolo is not part of the things that would not let you be constipated. But then again, we also encourage you to also increase fluid intake.
Okay.
Increase fluid. So on the line of increasing fluid intake.
Maybe if you are taking the Sobolo
as a form of your fluid, then that's fine.
Okay. So the images about the anatomy, yes, I think we can show them now. The picture, if you can kindly have the picture showing the yes. So this is one of the pictures.
So on our screens you see the anal region or your anus.
Yes.
So around the anus, just at the beginning, we call it the anal veg. Now, when you go up, you see the arrow pointing to the dentate line, like the finger-like projections inside. Those are the dentate line. And then you see a bulge above the dentate line. So that bulge is an internal hemorrhoid because it occurs above that dentate line.
Yes.
And then you see some coming below, down there. Anything that comes below the dentate line or the pectinate line is external hemorrhoid. So above is internal. Down is external. And this image also shows us the grade.
Yeah, you
grade.
mentioned there were 4 and they are showing 4.
There are 4 grades. The first one, we mentioned that it's not prolapse. You can see there is a bulge, it's enlarged and engorged, but it's not prolapse. The second grade is that it prolapses, but then it reduces by itself. And the third one is that it prolapses, but you have to manually reduce it or push it in with your finger. And the fourth one, it prolapses and you can't manually reduce it and doesn't go on its own too. Okay. So this is the image showing it. This image showing on our screen right now also shows the type of hemorrhoids that you have. The external hemorrhoids, the one that you can actually see with your visible eye. And then the internal hemorrhoids. So
that's the one
down there.
Yes.
It's labeled external hemorrhoid. And the one up, internal hemorrhoids, you can't see, is inside.
Okay.
Yeah.
Okay. So that's another.
Yeah, so this is a clearer view of the anal region and then the anatomy of the anal region. So we have your dentate line still there, and then we have your anal columns. You have the anus, anal canal where the feces, and then we have the hemorrhoidal veins.
Yeah, it's showing the blue.
Yeah. So we talked about them being blood vessels.
Yeah. Okay. Okay. So I hope now we can all appreciate what Doctor was talking about from the beginning of the show. So yes, we were talking about the lifestyle changes before this one. Yes. So as you were saying.
So for the lifestyle, if you have hemorrhoids, you think that you have Kooko, you have piles, and then Mommy, I didn't mention piles actually comes from pilia. Pilia meaning swelling. Yeah. So pilia is swelling. So that's piles. If you say piles, it basically means the swelling. Yeah. So for the lifestyle modification, increase your fluid intake. Okay. Increase fluid intake. 2, eat a lot of fruits and vegetables. Okay. It will prevent you from being constipated. Prevent you from being constipated. So then the fruits and vegetables, then we gave examples of some of them about the fruits that you can eat. About the fruits that you can eat. The fruits, we know a lot of them. The fruits, we also know a lot of them. You mentioned wheat, barley.
So anything with high fiber.
Cereal, high fiber diet. Basically, we are talking about high fiber diet for that. So if you do this, then you actually reduce your risk of being constipated and then your risk of getting increased pressure in your tummy, and then you developing this piles or hemorrhoids.
So for pregnant women who cannot do much about whatever is growing in them, yes, how can they also go about reducing their risk of getting the piles or the hemorrhoids?
Okay, mommy. So just like non-pregnant people, they can also do the things, lifestyle changes that the non-pregnant people do. And then the good news for pregnant women is that once they give birth, it actually abates. It resolves on its own. So one of the things, presentations of piles is asymptomatic. It has no symptoms. So for most people, they have piles, but then it's asymptomatic. Nothing is happening to them until it becomes symptomatic. Most people is asymptomatic. So most pregnant women will have it, but it's asymptomatic. But then if they have it and then they are having pain, we have these topical analgesics that we can administer for them.
Yeah.
And then when they give birth, these things self-resolve on their own.
Okay, all right. So if you're watching us and you have any questions, any suggestions, if you want to hear doctors' take on that, you can send them to us on 055-968-0066. So do well to send us your questions and your contributions so that you can have them answered. As we are talking about improving our lifestyle, yes, we should eat well, and eating well, we should take cocoa milk. It's good for everybody, right from the young ones to the elderly people around us. Everybody can take cocoa milk. And as I was saying, we have Pella Fest. I almost gave a discount to people, but then yes, I got it right. So we have the single tickets going for 70 cedis. Do well to purchase yours. We have the VIP tickets going for 150 cedis. And if you are a family and you want to save costs, right now Ghana is hard. Just gather yourself and 5 people can purchase this for 300 cedis. You can be a group of friends. You can actually be families. You can buy it as a gift to your co-workers and your neighbors and everybody. Let them come and listen to good a cappella and other music, and on the 31st at the National Theatre. So yes, Dr. Benedict. I never really spoke to you in school. I just used to say hello.
Yeah,
so today when I heard you were coming, I was like, oh, I get to talk to him anyway. So you've spoken to us about the lifestyle changes. Do these herbal concoctions work? The one that they will tell you that a beshik cocoa nase, it will burn it, you will not have it again. Do they work? Do all of them work, or some of them work and some don't work? What's actually the reality on the ground?
Okay, so mommy, the sad fact is that a lot of our herbal peddlers actually sell a good story. I mean, if you are in a VIP bus going from Accra to Kumasi, you'll be convinced, and by the time you get down, you've bought like 3 medications for yourself, because the cocoa is on your eyes, it's on your skin, it's everywhere. But today I want
even in your ears.
I want to debunk the fact that cocoa does not grow on our eyes, nowhere.
So it's not because of cocoa, that's why you're wearing glasses?
No. I mean, if you have any blurred vision, actually see an optometrist or an ophthalmologist, and then they'll sort it out for you. But don't attribute it to cocoa. If you have any skin lesion on your skin, don't attribute it to cocoa. See a dermatologist or a doctor who would actually assess it for you and give you the treatment required, because these are not cocoa. To the question of whether these herbal medications work, or they do not work, we've talked about the anatomy of cocoa piles. We've talked about what we do for them. So based on these things, we get to realize that at most these herbal preparations maybe help reduce the inflammation, but not to a beshinasi.
They claim it's it burns it.
No. I mean, if you are being realistic, and sometimes we also, the fault is partially us, because now we want the things we're experiencing to go. So we go heaven and earth to actually buy anything at all to the detriment of our health. And that's no good practice. I encourage anyone watching this show that if you feel like you have a pulse, a family, a relative has pulse, let the person go to the nearest hospital for the person to be checked.
Okay, so please don't go to your community center and the announcements they are making over the PA system. You just go and buy the medication. Well, I'm not here. We are not here to downgrade anybody's work, but we want you to be having the best of health. That's why we bring you experts in the field, doctors, nurses, lab people, lab technicians, and biomedical scientists. Everybody, psychologists, everybody is invited to the show so that we can all have a better understanding of things that are going on with our health. So we've been talking about the sit baths. How do we do it? How is it? You said lukewarm. You didn't really describe it. If you can give us a little bit of description.
So sit baths are actually, you actually sit in a basin containing not extremely hot water, because you don't want to scald yourself.
Maybe your degree of hot is different from my degree of
lukewarm.
hot.
I mean, those at home know what's lukewarm. Lukewarm is.
You know how our patients, somebody has heard warm and is thinking, oh, when I get water from the kettle.
I mean, anything that you dip your hand into, that it doesn't burn you for you to do ajish. You take your hand off. Fine. Yeah, that one is fine. Okay. So the heat actually, so you sit on it. Okay. Don't go and sit on extremely hot water.
No, I'm saying this because people, a lot of the time, we think, people think like us. We've been exposed to the knowledge, so we take some of these petty things for granted. But
that's true.
Yeah, please, you were describing the process.
Not extremely hot. If you get water and then you dip your hand and then you quickly remove your hand, don't sit on it, because you are going to get burns. Yeah. And the aim is not for you to get burns.
No, not at all.
So lukewarm, the one that you put your hand and you know that, oh, this is hot, but it's not going to burn me. Okay. Then you sit on it. So you can sit on it for like 30 minutes. You can do it 30 minutes. And then every day you can do it twice, morning, evening, morning, evening, morning, evening.
So some people put adal, is that adal?
Yeah, is that not salt?
The rock salt in it. Would you recommend that?
Well, if it won't harm your health, and then you can put your salt in it. You can put your salt in it. Okay. It also helps reduce the swelling that you are having at your inner region. Okay. Yeah.
So with the stool softness too, how often should somebody take it, or the person has to go to the hospital for them to prescribe it for the person?
Yeah, I think some of them are also over the counter. Some of them are over the counter. If you feel you are constipated, the main aim is to help you have free flow of bowel. If you feel you are constipated, you can first of all see a doctor. Yeah. He will show you, or a pharmacist who will show you how to use this stool softener and how often you use it. Okay,
so this is just by the way. Whilst I was doing house job, my boss would tell us that if you give anybody any stool softener and the person is going to toilet more than 3 times a day, you should just tell the person to stop taking this for a while. So I guess that's also good advice for those who get it over the counter.
You actually also don't want to tip into diarrhea where you are actually just going to the loo.
Okay, all right, that's good to know. So the people that we take them for the emergency, how do they cope with going like stool afterwards and all of that? What are some of the precautions those people have to take? Those who eventually have to go through surgery.
Okay, so when you are going for surgery, you'll be prepared by the surgical team. You'll be assessed by the anesthesia team. First of all, you go nail per os. Nail per os means that you won't be eating for some time.
I have so many stories to tell about
before you go.
Have you eaten? Oh no. Oh, I just took
Yeah,
Kooko,
in our
something.
Ghanaian setting, if you don't eat heavy food, you're not eating. I mean, some people, if they've not eaten some heavy
No,
food,
they said zero, nothing,
don't.
zero food, nothing, not even water, please.
Yeah, so
Okay,
you'll be prepared for that. You'll be told that you'll be kept up. You'll be given IV fluids. So you won't eat. That goes to say that then you'll be forming a lot of stool to pass, and then for the next 3 days that you'll still be going, or 2 days after the set, you'll still be nil per hour.
Yeah.
So you'll be going to the stool that much, and then afterwards you'll be taking light diet. It goes to say that most of the things that the stool that will be formed will not be hard enough.
Yeah, so
will be just yeah, and then you'll be put on also some antibiotics and some painkillers.
Okay.
Yeah.
So we have 2 questions here. The first one says, "Thank you for educating us tonight. My question is, supposing I already have it and it is visible, will practicing healthy lifestyle actually help it to go away completely?"
Okay, so thank you for your question. The point is that it's already happened. So then we talked about the grades. Now, are we looking at that one? Is it second degree, which comes down and goes on
by
its
itself? Yeah.
Or 2, does it come down and then you have to push it inside? Or 3, has it come out and it can't go? Or 4, is it an external hemorrhoid?
Yeah.
Okay, so if it's an external hemorrhoid, it means that it's formed below the dentate line. Practicing the health lifestyle is not going to let it go away. Don't let it go away. So your main aim is to make sure that it doesn't get thrombosed or it doesn't become very painful. So we talked about the things that you can use.
Yeah.
And then also the fact that you have it doesn't mean that you shouldn't also practice healthy lifestyle. Because then if you don't, it will exacerbate or worsen it.
Okay.
So practice the healthy lifestyle, but it's not going to make it go away. But the best thing is to go to the hospital. Let it be assessed. Let's see the grade it is, and then the management that will be recommended for you.
Okay. So we didn't get your name, but I hope your question has been answered. Ben from Atunsu also asked, he says, "Good evening, Mami. I wanted to know if there's a difference between fistula and hemorrhoids." Okay. So this is Ben from Atunsu.
Okay, sure. Thank you, Ben. So there's a clear difference between a fistula and a hemorrhoids. So we talked about the hemorrhoids and how they are. And then you also talk about, so in someone presenting with hemorrhoids, then you think about differential diagnosis.
You mentioned that at the beginning.
What else
could it be?
Yeah. What else can it be? At the top of the list, someone comes with a swelling at the anal region. Someone might even mistake it for condylomata acuminata, just a swelling there. If it's very painful, someone can mistake it for a fissure, more like a cut at your inner region. Someone can also mistake it for an inner abscess. Yeah. All these are different from hemorrhoids. And then someone too can mistake it for a fistula. But for a fistula, actually, you can actually differentiate between a fistula and then a hemorrhoid. So that's actually very easy to differentiate between if the doctor assesses you. So there are 2 different things, a fistula and then a hemorrhoid.
Ben, fistula is different from hemorrhoid.
Yeah.
You just need to go to the hospital and whoever it is, let them see you, listen to you, and touch you or examine you to know exactly what is wrong with you. Okay, so as I said, if you have any more questions or any contribution, you send them to us on 055-968-0066. So we have a few more minutes before we end the show. What would you tell people going through these things? They've tried all these concoctions. What should they do? What do you think they should do about these things?
Okay, so Mami, thank you. So what I'll tell viewers, 1, we must understand the fact that Kooko does not grow on our eyes. It doesn't grow on our skin. 2, there is help actually out there. There's help out there. So we've talked about the anatomy, how it presents, what can be done for you, to how you can also prevent yourself from developing it. So once you get to the hospital, you'll be assessed. Your history will be taken. What's happening to you will be taken if it's a blood that you see on your toilet stool, we ask you when it started, how long it has been, is it getting worse, is it getting better, anything that makes it better, anything else associated with it. A history will be taken. You'll be examined. I talked about we using our glove and the diary.
Yeah.
That's just one part of the examination that will be done. And then investigations will also be done for you to rule out other things. Other things that might mimic a hemorrhoids or Kooko. When the diagnosis is confirmed, then treatment will be given to you. So there is treatment available. If you sit in a car and then you feel like, oh, you're at your wit's end, you need to purchase something, just maybe give it a second thought and then visit a doctor first, and then you'll be sorted.
Okay. We don't have any more questions here, but then I was reading through some articles, and it looks like it tends, some people in certain families have it often than, because well, for my family, I've not heard of anybody having a hemorrhoid, unless of course they've not told me. But there are some people that everybody around them seems to. Is it familial? And is it because maybe they are not eating well, or there's some genetics behind it? What exactly could it be?
Oh, okay, so there's been issue with question marks with, is it familial? Is it genetics? If my father has it, do I have it?
Yeah.
Mostly, there's no genetic correlation with hemorrhoids. But what has been actually established is that in the family, you all tend to practice the same lifestyle. So then, if your father has, then the propensity that you are doing the same things as your father is high. So then you end up having, then you think that, oh, then it runs through my family. With just your lifestyle, the family, whole household is doing. That's why all of you are having it. And also, you must realize that as you go to the muscles down there also become loose. So you have a higher risk of getting this hemorrhoids too. So age also is. But in terms of prevalence in men and women, mostly in our communities, basically the same. Yeah.
Okay. So I don't know if you've seen these videos online where they claim it's Chinese tradition. Those who use the WC instead of the squatting method, you put a stool under your leg, and apparently it's supposed to help reduce the tourniquet effect.
You put a stool under your leg.
Yes, like you put a stool where your feet are, then you put your legs on it, and you sit on the WC. Yeah, does it work, or you are yet to look into that?
I think you are making yourself more comfortable if you do that.
Yeah, well, they claim that it helps to reduce the pressure there. I've been looking for information on it, but I was just hoping.
Well, I think these are not documented, so you can talk about them, but scientifically proven, unless we get papers to back all of these things.
Okay, so we spoke about sitting on the WC for long. What about sitting in general?
Sitting in general actually also does that.
Oh, okay. So it's not just the WC.
Yeah, sitting in
bankers, doctors that are always in the consulting room.
A lot of people are
secretaries
at risk. At risk. But then you can also say that it's multifactorial. So if you are sitting down and then you two are constipated.
But you know a lot of us don't eat well. We don't drink enough water. We are always complaining about having constipation.
That's true.
They are sitting for long.
That's true. So your factors, you've accumulated it. You are worsening your condition.
Okay. All right. So thank you very much, Dr. Benedict, for coming on the show today and giving us a lot of information about hemorrhoids. We hope that next time when we call you, you come, and as you've come here today too. So to my viewers, please, the Kooko is not what is on your face, or what is making your ears itch, or what is making your stomach turn. No, it is just the prolapse of whatever the blood vessels from your inner region. So please don't sit at home and use all these concoctions. No, go to the hospital, get seen by a doctor, get examined, and get the treatment that you need. I hope that we'll see you next week when we bring you another topic for discussion. Do well to have a very nice evening and a good week as well.